Good morning and welcome back. I'm joined by Dr. Casey Harbine for another edition of Morning Rounds. Thanks for waking up with us today.
Yeah, thank you.
And today we're talking about IBS, also known as Irritable Bowel Syndrome. First, let's just talk about what exactly is IBS.
Well, it's about as fun as it sounds. It's a very common disorder, actually, that affects the large intestine, and it's characterized by cramping, sometimes abdominal pain, bloating, diarrhea or constipation, or both.
How is it diagnosed?
So it's diagnosed basically clinically, so based upon those symptoms. And it's usually a diagnosis of exclusion. So most people who wind up with that diagnosis have been through a number of different imaging studies, CAT scans or ultrasounds, x-rays, maybe even an endoscopy study like a colonoscopy or something like that. And essentially all those things come back normal because there's nothing structurally wrong. It's more how the bowel functions, and that's very difficult to capture on any kind of imaging study, which is static.
So can it be life-threatening, or are there any lasting damage caused by it?
So probably the worst thing about it is it can be chronic, but it is not life-threatening, and there is no structural lasting damage. It can actually really have profound psychological impacts on people's lives. Because it's a pretty miserable thing to have. So it can have those kind of lasting impacts. And sometimes people can get control of the symptoms through diet and things like that. And sometimes it will flare, particularly at times of a GI illness or periods of stress.
So what are the causes?
So we don't really know the exact cause or etiology. It remains somewhat of a mystery medical illness. But there certainly are some things that we know can worsen it or trigger it. Anything that affects the way our muscles in our gut contract, so there are certain medical illnesses, certain medications, that can make it flare up. Anything that affects the nerves, because it's the nerves that tell the muscles to contract, so people with neuropathy or conditions that predispose to neuropathy or medications that can affect the nerves. And likewise, any kind of depression or anxiety that actually affects the neurotransmitters and the way the nerves work in our gut really can affect it. And then there are probably, if we get a bad GI illness like norovirus or a bacterial diarrheal illness, that will really make it flare up as well.
Are there any treatments for people out there with this?
So there's no magic pill. There are some medicines that maybe can kind of calm how the muscles in the gut contract, or maybe stop the diarrhea so much. People have found good success with making sure their depression and anxiety is well treated. There's even some mindfulness techniques and biofeedback that people can use that have been fairly successful.
All right, well, thank you for some of those tips here on Morning Rounds this morning. If you have a question that you would like us to address, you can just email it right to us, morningrounds@kpax.com.